Good afternoon. At the start, I would like to thank Prof. Dr. Ayman Fakhri, Prof. Dr. Ahmad Taha, for giving me this opportunity to talk about the new innovative solution by Molik to treat different types of wounds. We are Molik. Molik is a world leading medical solution company. Our purpose is to advance the performance in healthcare across the world. Our goal is so simple yet have a great value. Is to help patients heal effectively and efficiently so they can return to their lives normally through treatment, education, and the prevention of multiple wounds. Our heritage starts from 1849 as a textile company, the main supplier of gauze in Swedish hospitals. In 60, new materials is introduced to reduce the bacterial spreading of wounds. In 80s, SafeTac technology was invented by a portfolio of Meblex. Thanks to our R&D at 20s, Granulox was introduced to the market, and this is our topic today. What is Granulox? Granulox is a topical oxygen therapy used in healing of chronic wounds. Granulox simply work as a carrier for oxygen from the ambient air to the into wound bed. Through oxygen simply, once you sprayed, oxygen will be carried by hemoglobin, then introduced to wound exudate. The process is simply repeated until the saturation of tissue by oxygen. As per 3D imaging showing venous leg ulcer patient, oxygen saturation was in tissue 56%. After 20 minutes of applying Granulox, saturation was reached to 79%. And this was confirmed by multiple clinical trials from an expert opinion to reach a case study and then a systematic meta-analysis review to treat different types of wounds like burn, foot ulcers, leg ulcers, and traumatic wounds. May a question arise from our mind: is can Granulox can be used on infected wounds? Simple answer is yes. You can use Granulox on infected wounds as adjunctive therapy with antiseptic treatment. To wrap up Granulox, number one, Granulox can reduce the time of healing chronic wounds by 50% versus standard of care. Number two, twice as many chronic wounds healed at 8 to 16 weeks compared to standard of care. Less pain score reached 70% lower. Number four, less slough tissue by 99% versus 30% of standard of care. Treatment cost will be reduced to reach 40% lower than the standard of care. Thank you for your time. I happily to answer of your questions at our Granulox, at our Molik booth. Thank you. Thank you for